Valerie asks, what do RBRVS and GPCI stand for? And she keeps seeing this, and she doesn't really find an easy answer. And that's because it's really detailed and drawn out. But the basics about these two abbreviations are, the first one is the resource-based relative value scale, and the other is the geographic practice cost indexes. And ultimately, it's all about money. So what you're going to see when you look for this is this little somewhat of a definition. The enabling legislation and regulations, as well as Medicare carrier correspondence and forms, refer to the Medicare physician's payment schedule as a fee schedule. Now, you're going to hear that a lot. From the AMA's perspective, the distinction between a payment schedule and a fee schedule is extremely important. A fee is what the physician establishes as the fair price for their services they provide. For example, if he's going to come in and do a diabetic foot exam, it's going to be X amount, okay? And he says that's a fair price. So after that, let's see, a payment is what Medicare approves as the reimbursement level for the service. All references to the full Medicare payment schedule includes the 80% that Medicare pays and the 20% patient coinsurance. Likewise, tradition approved amounts also include the patient's coinsurance. So if the doctor says, I think my foot exam for a diabetic patient is worth $100, and Medicare says, well, we think it's worth $75, and then the patient has a 20% copayment, and then that makes up the full amount. Okay, Medicare's RBRVS, the Physician's Guide 2013, is a comprehensive reference manual for professionals. Okay, scroll down just a tad bit more. There we go. Let's see, it's a comprehensive reference manual for professionals, coders, physicians, and office staff to use in answering particular questions about RBRVS systems. In addition to providing the detailed background information and explaining all the features of the physician payment system, the Physician's Guide, which can be purchased, provides quick access to relative values by CPT code. Geographic practice code indicates explanation of payments, rules for surgical packages, and a summary of histories of payments and forms and stuff. So there's an example of this. And let's see, scroll down just a little bit more, Lorraine. I can't remember if I wrote any more after that. Okay, yeah, if we go to that link, this gives, that one. That'll give us, I tried to copy and paste it. It wouldn't let me do it. So scroll down to the next page. And I don't know if you'll be able to see this. It's big enough. Right there. See the box that says Medicare fee, go back up. Oh, she's making it bigger. That's perfect. See.
Which box?
Yeah, go down a little bit to this page. Scroll down a little bit more. There, right there. Medicare fee schedule payment calculation example. Now, this was way back in 2009. But, for example, when we look at this, code, CPT code 27603, without a modifier, and it doesn't tell you where it's going to be at, but the provider is a physician, and there's all types of providers. There might be a nurse practitioner, so on and so forth. It was done in the office. The work relative unit value is 5.120, and then it doesn't have a geographic value, and so the practice expenses they're saying is 7.130, and then it doesn't have the geographic again. And then, see, you just keep looking at all these totals. Ultimately, what that says is the fee is $468.51. That's what the doctor's going to get paid. Okay? So when you divide these up, this changes every year. And this is actually in a booklet, and it doesn't have to be all of this information at once. If you scroll down to the bottom of, I think it's the next page, it has one for chest x-rays. See right here, Medicare fees for chest x-rays 2009. So that 71010 with a modifier 26, which is a single, let's see, I think that's a 2-view x-ray of the chest, they're going to make $9.02. And then, and of course the modifier 26 makes a decrease in value. So anyway, this can be purchased, and your office probably would have one, and then you can look up the CPT code and kind of project your reimbursements and stuff. There's another slide that we're going to do later that has another link that really goes into more depth about this if you're curious, so you'll be able to see that, save that link. But it's really confusing, but ultimately what it is how much is the physician going to get paid once Medicare says this is how much minus, that we will pay you, and plus the 20% that the patient's going to pay. That's about it, guys. It's really not quite as difficult as it sounds, but it's kind of difficult to explain.
And most software will build this in that you're dealing with.
That's right. When you're a biller or a coder, you don't have to do this. This is already done. The computer does it for you.
What was that code?
I don't know. That's the chest x-ray. Yeah.
All right. So here's our single view chest x-ray. And 1-1 is a 2-view. Yeah. We want to look at the money. Let's fee schedule.
There it is. Yeah, one more over. There you go. Conversion factor, $14.97. And not okay. So a facility would be
state you're in. So
yes,
I wanted to put New Jersey.
If you think about that, it does make a difference. They do include geographics. Mm-hmm. So a doctor in Boston is going to get paid more than a doctor in Phoenix, Arizona, or Timbuktu, wherever that is at. I think Florida.
A rural area, yeah.
A very rural area, exactly. Geographics make a big difference. And what's included in that is the doctor's expenses. In other words, it costs more for a doctor to run his office in Boston than it does in a rural Eldon in the middle of Missouri.
Yep. Yeah, and all of your, Find a Code, Supercoder, all of these have, the fee schedules built into it, and they're just taken from the tables out there. So, but it is
right.
Kind of cool to see how things work together. And when you're trying to do a comparison and show physicians in doing physician education why it's more feasible to, code one procedure over another because the RVU is higher, and you can explain that, and that normally helps. When you convert things to money, people understand.
Right, and documentation is really the key for them. You just have to educate them in the documentation.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.